Hello, my name is Justin Lester. Talk about chlamydia complication. Definition. Chlamydia is a kind of sexually transmitted disease. It is caused by the bacteria Chlamydia trachomatis. It can infect both men and women. Women can get chlamydia in the cervix, rectum, or throat. Men can't get chlamydia in the urethra, inside the penis, rectum, or throat.
Hi there, my name is Dr. Dominic Rowley and I'm the Medical Director of Let'sGetChecked.com. I'm also a consultant physician in genitourinary medicine. This is also commonly known as infectious diseases in different countries. I'm here today to talk to you about chlamydia infection because this is one of the most commonly sexually transmitted infections in the world, and it's also one of the most common infections that we find diagnosed through our kits. So what is chlamydia? Chlamydia is a sexual infection and it's caused by a bacteria called Chlamydia trachomatis.
Application is nursing. The infection is caused with antibiotics. You can take them in a single dose, or you may need to take medicine for 7 days. Antibiotics will not cause any permanent damage the disease has caused.
Hey guys, hope you're well. Beautiful day outside, so I thought I'd do a video outside today. Really quick video on chlamydia treatment as per 9CKS. If it comes up in a medical exam or a medical exam role play, you've got to know the current treatment. It used to be azithromycin 1 gram, and I see a lot of people still putting that as their answer. But remember, it's changed fairly recently. So first line now, if you're above the age of 13, doxycycline 100 milligrams BD for 7 days. Doxycycline 100 milligrams BD for 7 days. That is first line treatment. If this is not tolerated, if this is contraindicated, then you have two choices for second line as per 9CKS. Choice number 1, azithromycin, 1 gram on day 1, but that used to be the old dose. You stop at that. But now you have 2 additional days, 500 milligrams on day 2, 500 milligrams on day 3. So it's a 3-day course of azithromycin, or erythromycin, 500 milligrams BD for 10 to 14 days. Erythromycin 500 BD for 10 to 14 days. So first line choice now, according to 9CKS, is doxycycline for a week. If you can't take that, either azithromycin for 3 days or erythromycin for 10 to 14 days. Make sure you have a look at the guidelines to get them more updated. There's other rules for people who are pregnant, other rules, of course, if you've got allergies to these things. We'll do a different video on that in the future. Much more like this on YouTube, Instagram, Twitter. Check out Dr. Aman Arora or the website auroramedicaleducation.co.uk for our online courses, audio courses, and face-to-face courses as well. Hope this helps. Hashtag CanPassWillPass. Hashtag I went with Aurora. Have a good day.
Pros and cons. Pros. The only sure way to prevent chlamydia is not to have vaginal, anal, or oral sex. The correct user like condoms greatly reduce, but does not eliminate the risk of contracting and spread chlamydia. Cons. You can get chlamydia during oral, vaginal, or anal sex with someone who has the infection. A woman can also pass chlamydia to her baby during childbirth. Chlamydia is more common in young people, especially women.
Helping make your life easier. Moms every day. Good morning, I'm Katie Kunkel. The words, "you have chlamydia," are ones you hope to never hear, but unfortunately, they are all too common, and many people don't understand the health issues related to the disease. Today, Rhiannon Riley, nurse practitioner in the obstetrics and gynecology department at Mayo Clinic Health System, is going to talk with us about chlamydia and how it can lead to fertility issues for women. Good morning, Rhiannon.
Good morning.
So first of all, what is chlamydia and what are the common symptoms?
So chlamydia is a sexually transmitted infection, and it is commonly asymptomatic, meaning that people do not usually have symptoms when they have this infection. If you do exhibit symptoms, they can include abnormal vaginal discharge, pelvic pain, abnormal bleeding, and also pain with urination.
Okay, so how common is chlamydia?
So chlamydia is the most common sexually transmitted infection, and in 2013 alone, 1.4 million people were diagnosed with chlamydia in the United States.
Okay, so who should be screened then, and what can we do to prevent it?
So chlamydia screening really should be focused on younger women especially. They are at 3 times more risk for developing chlamydia in their lifetime, and we do recommend screening for women 25 years and younger, also with screening with new partners as well.
Okay, and so what are the possible long-term consequences of the disease?
So long-term consequences from chlamydia can include pelvic inflammatory disease, ectopic pregnancy, infertility or difficulty getting pregnant. Also, there can be infections in pregnancy that can lead to problems with the newborn as well.
All right, so very important to get screened.
Incident plagues in Ecuador. Chlamydia common infection in Ecuadorian pregnant adolescenthood and the CAIA of the Gynecobstetric Hospital Isidro Ayora of 41.8% is higher than in the most studies carried out and could be due to the population statistics. Adolescents and pregnant women with higher biological condition than the adolescent women over 25 years old or not pregnant.
So chlamydia is a very common sexually transmitted infection that we see. It is a bacterial infection, which means it's unlike some of the other viral infections that can live in your system long term. It can be treated because it's bacterial, so it can be treated with antibiotics. The most important thing about a chlamydia infection is that it is necessary to treat it early and completely to avoid the long-term consequences of having an undiagnosed bacterial infection in the genital tract. One of the most worrisome things that we see in relation to chronic chlamydial infection is infertility that's related to scarring, long-term chronic infection of the genital tract.
Conclusion. If chlamydia is not treated in time, it has very serious consequences in the case of women, as it can cause infertility since it damages the uterus and fallopian tubes, as well as the urethra. For this reason, frequent gynecological check-outs are important and to ensure the well-being of sexually active women. Remember that it is important to use a condom during a sexual relationship and throughout the encounter.
There once was a girl called Lydia who knew nothing about chlamydia. No advice had she read about how it is spread. For her, it was nothing but trivia. But then Lydia met her dream boy. On dates, he filled her with joy. One thing led to another, ending up under the covers. They thought they'd found love. Wow, oh boy. Now the thing was they used no protection, as Lydia used pills for contraception. But they forgot that a condom is how you stay safe from a sexually transmitted infection. Weeks passed and Lydia felt fine. She'd not been ill or seen signs. But chlamydia is so, you can have it and not know, and your fertility can start to decline. To help put their mind at rest, they decided to go take a test. At the clinic they were told that they'd been way too bold. It's positive, oh no, what a mess. The clinic staff said, please don't fear. With antibiotics you'll be clear. But in future, please Lydia, stay